Well, it's been a couple of weeks since I spoke with Dr. Tanya Altmann about what's going on with the COVID-19. Things have definitely changed, Doctor. Nice to have you with us. I mean, now we're talking about getting out, reopening. How are you feeling and what are people telling you?
Yeah, you're right. I mean, so much has changed since we last spoke, and it's still changing day to day and week to week. And I'm still not sure exactly what is going to happen. I mean, even though people are talking about reopening, I'm not confident that we're ready yet. I'm worried about a resurgence. So I'm just kind of taking it day by day, and sort of step by step.
So, okay, so interesting you said resurgence because I'm still wearing my mask when I go out. Not wearing gloves. I just decided I'm going to wash my hands more, try not to touch my face. So these are like personal decisions that I'm making, and I'm listening to what's going on in the government, what they're trying to tell me to do to stay away from all those public places. But look, I've been going to the grocery store and it's fine. So I'm starting to feel like that's okay.
Yeah, and I've been going to the grocery store as well, but I have been limiting the amount of times that I go. I only go once a week. And I think because so many people are ordering online, that's why the grocery stores are a little bit less dense, which is what you want. You want to de-densify all those places we're going. I've been wearing a mask. I agree with you. I only wear gloves in the office because I see too many people out and about wearing gloves and still touching their face and cell phone and car doors and steering wheel. And there's no point then, right? You might as well just wash your hands and sanitize a lot. So I save the gloves for when I'm in the office needing them for medical procedures. It is interesting. I have been, talking to a lot of camps and schools and businesses. They're asking for my recommendations on how to, safely open. And although I'm definitely providing, my advice based on a pediatrician and school physician, we still do have to wait for the governor and the county, to give us those recommendations and sort of the green light. And then when it does happen, I want to go really, really slow. I mean, I still don't think that just because a park is open, it means you should take your kids. If you have a space in the backyard where they can play, stay and let them play in your backyard and save those parks for the people that don't have the space. Because if we have too many people together in the same space, we're going to start seeing the numbers go up again.
All right, so you're a scientist, you're a doctor, you understand the dynamics of disease, and that's something that you deal with on a day-to-day basis. A lot of us don't get that, so we're really reliant on information from the media and from our leaders. So as a doctor, what advice would you give us, as far as day-to-day activities and as we start to venture out?
Sure. So the most important thing is still social distancing. So when you do start to venture out, you want to make sure that you're still at least 6 feet away from others, that, you wear masks to help protect others from getting your germs. So I think social distancing, mask wearing, good hygiene, like constantly washing hands and being aware not to touch your face, being careful when you touch your phone that you disinfect it. Those types of things are going to be really critical to making sure that we decrease the transmission of the virus, within our community.
So we mentioned resurgence. So let's talk a little bit about what that could look like, because people are saying if we suddenly just go for it and everybody's out, we'll see this spike again, and then we really messed with ourselves.
Right. And we don't want all these weeks and months that we've all stayed home and been so careful to, really go to waste and have to backtrack again. And so that's why we do have to be cautious and careful about how we do this. And some of the things that I'm talking to some camps and schools about that, are thinking they may need to open this summer, especially camps that might be for essential workers, right? All the nurses and doctors and firefighters out there that have to work, they need daycare for their kids. So we're kind of looking at ways to restructure. What will that new normal camp and school day be like? And it will be de-densifying, so maybe scattered drop-off times. We may not run buses. We will probably group the kids into small groups, like maybe less than 15 in each camp group, and they will be with those kids all day long. They won't mix with the other groups. And that way, when there is a case, we will be able to, test, isolate, and contact trace much more easily.
Well, that's what that was my next question. My final question to you is that test, isolate, and figure out what we're going to do next. How do you see that moving forward? Is it going to be like when I was a kid and everyone got a polio vaccine so we wouldn't get polio? Is it going to be that pervasive, do you think?
Well, when the vaccine comes out, it possibly will be, but we still have time until that vaccine is going to be available. And even though, they're working really quickly on it, and some are speculating, even Dr. Fauci has been saying that, maybe by January. I mean, that's still really like the best case scenario. Right. So when kids go back to school, we're not going to have vaccines yet, but we do have testing. And I have to say, in Southern California right now, we are pretty lucky with the amount of testing that we have available for everyone, which is good. And I'm hoping this summer that rapid testing will be available, point of care testing in doctors' offices or at public health. So there might be scenarios where if there is a case in a classroom, we go in and we test everybody in the classroom, or we do surveillance testing to help sort of, lock it down so it doesn't spread. So if there is a case, you might have to quarantine one class, which will be a small class, and not an entire grade or an entire school.
Yeah. Finally, one last thing. What advice would you give us today in the next few, let's say, like next 2 weeks?
Well, in the next 2 weeks, I really don't see that we're absolutely ready yet to reopen and get out there. I mean, we have to have this steady decline in cases, and then we have to have a safe way to go about it. And although there are a lot of people working on these plans, I am concerned about some of the businesses that want to open. And I understand for economic reasons they really want to do that, but I don't want us to be, to miss out on really important steps that need to be taken to keep our community safe and healthy. So I think the next 2 weeks, we're still going to all be mainly at home unless it's absolutely essential that we go out. And so I'm looking more towards after July 4th for opening some camps and things like that. But I think, for the next month of May, we're still going to be home most of May. And I think that's really the best thing to do. Dr.
Tanya Altmann, thank you very much for your expertise and your advice. We will take you up on it, and we'll visit in a couple weeks.
Sounds good. I'll talk to you later, Carlos. Stay safe and healthy.
You too. Thank you.